One of the things you will be offered when you arrive is a nerve block. This is an important tool we use to take pain away from your procedure. The most common type of nerve block that we perform is called an interscalene block. It is a very safe, a relatively painless procedure that hurts about the same as getting an intravenous catheter.
After checking in, you will be assigned to a bed in the preoperative area. The nurses will begin preparations by attaching a series of monitors that will measure your heart rate, blood oxygenation, and your pulse. An IV will be started. A blood pressure cuff will be attached. A series of medications will then be given to you. This includes an antibiotic to decrease the risk of infection, as well as Celebrex, which is an anti-inflammatory medicine, intravenous Tylenol, which is a pain medicine, and Lyrica, which decreases nerve pain. This cocktail is designed to help keep your pain to a minimum. The procedure is performed at the bedside. The anesthesiologist will use a probe from an ultrasonic imaging machine to help place the needle in the correct position. The probe is placed against the neck, and the nerves are visualized on the screen. The anesthesiologist places the needle carefully connected to an electrical probe to check for proper positioning. When the proper position is reached, the hand will jump. This is normal and nothing to be worried about. Next, your arm will begin to feel warm and numb from the cheek down to the tips of your fingers, and you will stop being able to move your arm. Next, the anesthesiologist carefully secures the sheath and then threads in the final catheter. As you can see, this looks very much like an IV. In the operating room, the circulating nurse will then fill up the pain ball with numbing medicine. This ball is then attached to the patient and secured in the recovery room.
The nerve block is a very safe procedure. Because there is a use of a needle, there is always a very small risk of bleeding or infection from the needle. There is a very small risk of damage to the nerve during the application of the medication. Even rare side effects are, you may notice one of your pupils larger than the other pupil. This is actually not uncommon, but it's very safe and very short-lived. There's also a chance that your eyelid may droop after this procedure. Again, very safe and very short-lived. An even less common side effect from having a nerve block is having the medication go to a nerve that affects one of the lungs. This results in having difficulty taking a deep breath and possibly even hoarseness. This resolves and is not dangerous. At the end of 3 days, what we would like you to do is take the dressing off and pull the pump out. It's that easy. It's similar to removing a Band-Aid. And then you take the pump and the catheter and throw them in the garbage. When you get home, some things you may notice are leakiness or wetness around the catheter site. This is not concerning. You can simply place another dressing over the site of the leakiness and don't worry. We would like to hear from you if you have any metallic taste in your mouth, if there's any tingling in your tongue or your cheeks or your lips, or you're having difficulty breathing.
An information sheet will be given to you with contact information and follow-up instructions.